Three, two.
Hello, everyone. Good morning. Thank you for joining us, and welcome to our weekly media briefing and public health update with Montgomery County Executive. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today are Dr. James Bridgers, who is the Director of the Department of Health and Human Services, Dr. Nina Ashforth, the Chief of Public Health Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer, and our two guests this morning are Maryland Senator Craig Zucker, as well as Vincent DeMarco, who is the President of Maryland Healthcare for All Coalition. Thank you for joining us, Mr. County Executive. The floor is yours.
Thank you all, and sorry about my technical difficulties. I've never had my mic and my camera fail at the same time before. This is quite priceless. Anyway, thanks for joining us. And on Monday, I was down in Annapolis for the end of the 2026 General Assembly session. It was good to see that the state was able to close that budget gap. But they've got a lot of work to do for next year, and I think everybody understands next year is going to be an interesting year for them and for us as well. Donald Trump has certainly disrupted the flow of things at the state level, and targeting Montgomery County and Maryland in particular has been a hallmark of Trump's administration so far. One of the many highlights of this session is the utility reform bill, and it's expected to save the average resident about $150 a year. To do that, the state pulled money from the Green Energy Fund and redirected another $100 million in order to lower those utility surcharges. But that is one of the biggest concerns people have around the state, is the skyrocketing energy prices. I was actually in a meeting yesterday with folks from Pepco, and they were showing me something that was very interesting. It was about Constellation Energy and what the cost of energy was per kilowatt hour from Constellation a couple of years ago. And it's gone up almost 8 times in the last 2 years. Has nothing to do about the cost of producing energy. Their power plant is the same power plant. None of their costs went up. This is all about selling into markets. And the shortage of energy has driven up the price of electricity, and Constellation is now making 8 times what they were making before, at least, on the same energy supply. So that's something that hopefully in the long term we can deal with, because you can't have everybody subject to markets to the extent that this is. It's not like their costs went up, which would be understandable for increasing the price of energy. This is just taking advantage of markets. We're all paying for it. The budget also had reductions in planned growth in disability services, and the cost shift is going to put greater burden on local departments of health and human services and our community partners. And this is one of the things that we're going to have to look for locally, because my concern is that we wind up losing the healthcare, the ability of our providers to provide disability care. And that would be not a good thing to see reductions in those services. So there's lots of reasons for us to think about, how we move forward as we go into next year. We have also, though, had some really good successes in Annapolis. The lawmakers allocated $172 million to fund more than 130 projects across the county, including $54 million for 11 schools. And there's also $15 million earmarked for the Nancy K. Kopp Public School Facilities Priority Fund. A little more than $118 million is going to be spent on capital projects, including water quality improvements, work on the Montgomery College campus in Germantown, redevelopment in White Oak, other projects to improve our quality of life by improving bike trails, theaters, libraries, and parks. And they help seniors and children, adults, and animals, and they help upgrade gathering places that are important to our community. This year's capital funding is $37 million higher than last year's state allocation. And I really appreciate our state delegation for securing these funds and supporting legislation that benefits immigrant communities, prevents evictions, protects the environment, and expands our economic development opportunities. So, as usual, the legislature has delivered really well for us. Our delegation has done a great job in bringing things back to the county, even in hard times. And trust me, it's more appreciated than ever, because when we're looking at all the cuts that people have had to deal with, getting on the plus side of some of these numbers is a big deal, particularly on the capital stuff that relates to the things we have to build here. I want to introduce our first guest speaker this morning, Senator Craig Zucker, represents District 14. He's on the Budget and Taxation Committee, and he chairs the Capital Budget Subcommittee. Good place to have Craig. He's served on the Senate since 2016 and currently chairs the Democratic Party caucus. So welcome, Craig, and thanks for taking time to talk about the work you guys have done.
Well, thank you very much, Mr. County Executive. And let me just say thank you to you and the entire team on here. I know nothing could be done alone, and that goes for the work that we did in the Maryland General Assembly as well. Nothing can be done alone. Mr. County Executive, we really focused on three things this legislative session. One was lowering costs, two was growing the economy, and third was protecting Marylanders and Montgomery County residents against a reckless Trump administration. But for the purpose of this call, I really wanted to focus on the growing the economy piece. Mr. County Executive, I think you and the entire county government and county council should be very proud of how well positioned both the Montgomery County House members are and senators. We really took a one Montgomery County approach where we were all in this together and making sure that we were looking at every part of Montgomery County and where we can invest it, whether it was Damascus and Clarksburg to Long Branch, Tacoma Park. We brought back record amount of money when it comes to school construction, and we took what you all had as your priorities and went to work for you and the county on behalf of Montgomery County residents. Mr. County Executive, you mentioned the COP fund. That's sort of a nuance. What that is that is extra $15 million that we brought back, the House and the Senate brought back in unrestricted school construction funding. We had heard from our partners in the county that we need more school construction funding. So we doubled down and brought back more than $50 million worth of school construction funding. Much of that, Mr. County Executive, is unmatched because I know that some of it is, when we bring back sometimes money from the state, it sometimes ties the county's hands. We wanted to make sure that the hands of the county were set free and making sure that you guys had as much access to this funding as possible, especially given the tough budget year. But if you think about what we accomplished, and a lot of that dealt with the relationships and the positional strength of where the House members are and the senators are. We've got new committee chairs in the House who represent Montgomery County, and we have continued Senate leadership who are from Montgomery County, which provides us exceptional strength where we can go through your priorities, the county's priorities, and systematically fund each as many as we can. So when you think about public safety, where we double down and help fund the 4th District Police Station and the only police station focused on healthcare, whether it was Adventist or MedStar Montgomery or Suburban Hospital, Young Artists of America and Strathmore Hall. I know that Andrew Friedson and Senator Kagan were very instrumental in the Young Artists, as well as everybody. I mean, this is a team effort, but there's a lot to be proud of. We left the state budget in relatively good shape. We have more than $250 million in cash, as well as a savings account of more than $2.2 billion. So that's our rainy day fund. But Mr. County Executive, bottom line is that we understand that we work for the county residents, and we want to, and I think it's important for people to understand that government works well together. And Mr. County Executive, I think this session helped to demonstrate that, where we worked hand in glove with the county, and certainly appreciate the county leadership and appreciate the teamwork this session.
Thank you, Senator. Members of the media, if you have any questions for the Senator at this point regarding the Maryland General Assembly, please raise your hands if you have any questions. No questions for the Senator this morning? Well, Senator, thank you so much for joining us. We do know that you need to leave, so again, thanks for being here today. Oh, I see Jenny. Jenny, good morning from WAMU. Jenny Obama, good morning. Go ahead. You might need to unmute yourself.
I mean, okay, you can hear me now.
Morning.
I just wanted to ask a little bit about the stop sign legislation. I know there was something that passed that was about like a stop sign program, a pilot program that was in Montgomery County, expanding it. I think it was in Gaithersburg and Rockville. Just kind of curious what the goal of that is.
Yeah, I mean, I think this was something that passed through both the House and the Senate. I think it's just to see what if run a pilot program to see if we can prevent people from running stop signs. I think that the county and the state have been focused, and I know David Moon, big salute to David Moon and others on the Vision Zero, and I think this is all tied into that. We care about pedestrian safety, and certainly I know that I live at a four-way intersection, and sometimes people are running through those stop signs, and I just pray that a child doesn't buy. But I think this is just to test the viability of this type of program in a measured way.
Jenny, for your benefit, the legislature I think gave Tacoma Park the ability to do a pilot last year, and so this expands it to Rockville and Gaithersburg. And I think the pilot in Tacoma Park is really just getting up and running, so we haven't gotten great data back from it yet. But I think we're all very excited about the safety enhancements that the stop sign cameras will do. It. If you've been around Montgomery County, or frankly anywhere in the country, you know that people are willing to ignore a stop sign in some cases, or certainly not, stop with great fidelity, particularly when they're turning from one road onto another. And a lot of our traffic-related fatalities occur in intersections where people are attempting to cross and people are either ignoring stop signs or in some cases lights. So just wanted to add that additional information to Senator Zucker.
Thank you. And can I just ask one more thing, Senator Zucker? There was a
Yeah.
lot of talk about redistricting, and that didn't pass. There were a lot of senators that didn't want to comment on what their position was on it. I'm curious, what was your position on it? And the governor says that he's still not done. So I'm curious about that too.
I would say that at this point, the discussion on redistricting, we're adjourned. So as far as that item is passed, and we're heading into an election cycle, so I would say that right now the General Assembly, at least I know the Senate and the Democratic Senate and House leadership, as well as the governor, are focused on lowering costs, growing the economy, and protecting Marylanders. And I think that at this point is our biggest focus. And also ensuring that the $250 million we brought back in capital funding is going out the door, and Montgomery County residents are feeling the benefit of it because that's what we brought back from Montgomery County.
Thank you, Johnny. I see Tosin Vakil from DC News Now has a hand up. Good morning.
Hi, good morning. Thank you for taking my call. Two questions. The first one obviously answered about redistricting. The following is, I know energy cutting costs was a big deal for lawmakers this season. Besides the 150, is there anything else moving forward that you guys might be considering, actually very tangible, that people across the state and in Montgomery County will get to see and feel to help them with the cost?
Yeah, I mean, well, we moved significant legislation that'll help lower the costs for lower income families with a lot of energy assistance, and then tying that with the capital budget, where we're providing more, I think over $50 million in rental housing assistance and affordable housing construction. I think it's going to be a perfect positive storm of both rate relief and providing opportunities for both Montgomery County and Maryland residents. We certainly understand the impact of the economy, and a lot of this was based on things completely outside of our control. It was coming from the federal government. I certainly know the county executive and the team in Montgomery County have felt it. And Mr. County Executive, you're just trying to react to kind of the onslaught that's coming from the federal government that you had nothing to do with, but we're
Yep.
still responsible for taking care of people.
That you said it really well. I mean, the thing that concerns me is, when Trump, I'm going to say this later, but basically I was wanted to hear it, he's made a point of shifting responsibilities to local government. He said flat out, we're cutting the federal government. All these people are getting these amazing tax cuts, and I'm shifting this to the states and counties. He didn't even say he was getting rid of it. He said he's shifting it. So I think about some of my friends who welcomed his election and they're shocked at the budget situation it leaves us in. It's like, well, if you shift these to the county, how exactly do you expect us to pay for it? If you shifted the responsibility and the money, I'd be happy to take the responsibility and the money and not have to deal with the federal agency. But when you give us the responsibility with no money, basically what I think he's hoping for is that everybody decides they can't afford it. And then we start on a downward path of unwinding a whole bunch of things we've put in place to make a safer, better community, whether it's affordable housing or homelessness or support for healthcare. He's putting us in a situation where it's either you deal with revenues or you shrink what government does to the harm of the people you represent. That's a tough bind to put people in. I know because I'm in it right now.
Any other follow-up questions, members of the media? No more questions? All right, Senator, thank you so much for joining us this morning. I guess you do need to go, and have a great afternoon. We'll see you soon.
Thank you all. Appreciate you.
And Craig, I promise the money will go out the door into these projects as quickly as
Oh, I
possible.
know. Absolutely. I trust you guys.
No.
Thank you.
So thank you. And I'm going to start talking about our Maryland Prescription Drug Board, another good thing the state has done. One issue I've been supporting for years is to push to lower the cost of prescription drugs in Maryland. The work done by Maryland's Healthcare for All Coalition and Maryland Prescription Affordability Board is going to be life-saving. The latest move to set upper payment limits on the diabetes drug Jardiance is another example of how it takes an effort to make our state more affordable. It's great to see all the amazing scientific breakthroughs in the healthcare realm. I actually truly love the work that's being done. But if people can't afford the drugs, the benefits are greatly diminished. I want to thank Speaker Pena Melnick and members of our own delegation, like Senator Brian Feldman and Delegate Bonnie Cullison, for their efforts. And I know Bonnie's retiring. She's been a real champion of this for all the years she was in the legislature. I just want to give her an extra shout out for that. And I'm glad to be part of a bipartisan group of county executives and the mayor of Baltimore that supported and advocated for these reforms. And it takes advocates at the state level to really make all this stuff happen. And that's why I've invited Vinny DeMarco here again today. He's been here before. He's president of Healthcare for All Coalition, and he continues to beat the drum to overcome other hurdles that consumers face when it comes to both healthcare and prescription drugs. And more than that, though, he's been championing healthcare reform in this state for decades. Vinny, I know you from back when I was on the Tacoma Park Council, which was beyond 20 years ago. So you've been doing this forever. I really appreciate your tireless, and I guess tireless is what you have to be if you're fighting for healthcare in this country, because it's not something that comes naturally to a lot of people in understanding what we need to do. I invited you here today to talk about the work on behalf of all Maryland residents. So thank you for joining me again.
Well, thank you, Mr. County Executive, and thank you for being there right from the beginning. Maryland in 2019 enacted the first in the nation Prescription Drug Affordability Board. And as you know, it was not easy. Big Pharma fought it tooth and nail, and there was a reason why no other state did it till then. But thanks in a large part to the leadership of the local leaders, the county execs, County Executive Elrich, and so many others, the Mayor of Baltimore, all the county execs came together and said, we have had enough. We've been gouged too much by the high cost of drugs. Your colleague, Stuart Pittman, says that in Anne Arundel County, they spend more on prescription drugs for county employees, double as much than on libraries. It just makes no sense at all. Well, the board was enacted, and Governor Wes Moore has been very, very supportive. And of course, the lead sponsor in 2019, as you mentioned, was Speaker Jocelyn Pena Melnick. We're doing a press conference with her here in Baltimore in a little bit. With Delegate Bonnie Cullison will be there also. But as you said, on Monday, the board took the first action under this law, and it will put an upper payment limit on the drug Jardiance. It has the authority to do that now for state and local governments. And as of January 1, 2027, state and local governments would save over $320,000 a year because of this upper payment. The upper payment limit amount is the same that's under the federal Medicare maximum fair price that Medicare has negotiated with drug companies under the Inflation Reduction Act, which is, of course, enacted by President Biden, but President Trump is also implementing. So that amount, that upper payment limit, is going to save a lot of money for state and local governments. Under the law that you supported that got enacted in 2025, 1 year later, the board can set upper payment limits for everybody. So we're expecting by January 1, 2028, they'll be able to set upper payment limits for everyone for Jardiance and other drugs. And for Jardiance, the savings will be for all Marylanders between $9 and $16 million a year. $9 and $16 million a year. Then another drug they're looking at right now is Ozempic. That hopefully they will set an upper payment limit soon. That will save state and local governments $5.8 million a year starting January 2027. And then, Mr. County Executive, when that goes to all Marylanders, the savings will be between 115 and 164 million per year. Dramatic savings, and they're going to, I think, address many other drugs. The Prescription Drug Affordability Board is working, and at least 3 other states, Minnesota, Washington, and Colorado, have also enacted laws like this. Colorado set an upper payment limit for Enbrel, which is going to save its people tens of millions of dollars. As you said, drugs don't work if people can't afford them. Our insurance rates go up because high-cost drugs make our premiums higher. It doesn't have to happen. Other nations do upper payment limits. Medicare is starting to do that. We're doing it in Maryland. We're leading the way. And I want to thank you so much. I'm going to miss you when you're not around. You are a great leader, and your ability to help us get this done was incomparable. So thank you so much. And Senator Zucker was on before. He's been a big supporter. The Montgomery County delegation, all supportive. So thank you to all of them. And I'm going to also miss Bonnie Collison when she's not around anymore. Great leader. But my message is drugs don't work if people can't afford them. In Maryland, we're doing something about it. So thank you.
Thank you, Mr. DeMarco. Members of the media, any questions regarding affordable drugs? Any questions for Mr. DeMarco?
And I do have to run to this press conference.
Yes, we know. Well, thank you so much for joining us. I'm sorry we kept you a few minutes.
No problem. We love Montgomery County. We love Marc Elrich. Bye-bye, everybody.
Thank you.
Okay, Mr. County Executive, other topics.
That was a fun topic. He's really been a great champion of this for all these years, and none of this stuff would move in Annapolis if it weren't for the kind of consistent lobbying and his ability to build a coalition to support this work. I know the meaning of the coalition because I think back when they first pushed this, I was part of a TV ad along with a Republican county executive. And we did that to show that this isn't a partisan issue, that everybody on both sides of the aisle recognizes the need to bring some control to the cost of prescription drugs. And, as a county executive looking at a budget here, the impact of the weight loss drugs has been enormous on insurance costs for some parts of the county government more than others, but it represented a totally unforeseen expense. And the good thing about the drugs, though, is that more than weight loss, they have benefits for people's general health. And we're hoping that sometime soon the health system actually recognizes that if you're treating people with a weight loss drug, you wind up treating a whole bunch of other stuff, which is expensive to treat. So looked at only as a weight loss drug, it's not cheap. Thought of in terms of what else it can do to benefit people, I think there's much more upside to those drugs than has been acknowledged so far, at least acknowledged in the terms of policy. On other matters, I want to talk a bit about our operating budget and the SALT deduction. Today is tax day. I wanted to use this opportunity to explain why proposed operating budget works. And the same federal legislation that's been cutting services, pulling back from education funding, and shifting responsibilities to states and counties has also delivered a significant tax benefit to many Montgomery County residents. I noticed when I was doing my own taxes how much the federal tax cut I'm getting, and I was kind of surprised that it's noticeable. During last week's media briefing, I noted the federal tax cuts have reduced the burden on many county residents, but at the same time, the federal government has cut essential services and programs. The president was perfectly clear that he was shifting many federal burdens to local jurisdictions so that the federal government can enact his big, beautiful bill and the tax cuts that come with it. Now, most people, even in the middle class, are getting some tax cut. In the middle class area, the tax cut's not huge, but it's certainly better than no tax cut. The wealthy people are getting astounding tax cuts. And it's just alarming that the president would gut all these programs in order to give wealthy people large tax cuts. It's like not exactly something we needed to do. And shifting the programs to the state without sending us the money that goes along with it is going to pass the load on to local governments like ours. I mean, literally, if you say I'm shifting responsibility to state and government, if you were a Trump supporter and you supported them here in the county, and now you're shocked that the county has to pick up the load from things that used to be federal responsibilities, you shouldn't be shocked. He said he was shifting the responsibility. He didn't say that nobody should have any responsibility. He just said he's shifting it. Well, when you shift responsibility, you shift costs. If he had sent us the money and said the federal government's not going to engage, but we're just going to give you the money to do it, I could have lived with that. But getting the responsibility with no money has not been very helpful. Now we're in the county, we're not proposing to backfill the cost of the people who are losing health insurance. Our nonprofits that provide the clinics in the county have projected a pretty significant uptick in people who will be using the clinics because they're not going to have access to health care. There are thousands of people who are going to lose health care. And if that lands in our clinics aren't budgeted for the number of people who are likely to need health care coming into our system. And that wouldn't have fit into last year's budget. I'm already getting requests from the nonprofits that they need funding to get them through the rest of this year because of the uptake in the number of cases they're seeing. So it's just absolutely unrealistic to think that this could happen at the federal level and there aren't going to be impacts on the local level. The cuts, shift real costs to the county, and it's real. And we know on top of all that, the president targeted Maryland and Montgomery County for major reductions that have impacted our growth projections and revenue growth. For us, revenues are still increasing, but at a far lower rate than they were pre-Trump. In my time as county executive, we've met our revenue targets, our reserve targets for the first time ever. Not only did we meet them, we've exceeded them consistently. And we've exceeded them by a fair amount of money consistently. This year's budget's a little bit different because we had revenue projections pre-Trump that would have seen us going along as we've been going along. And then the post-Trump revenue estimates were sharply reduced. And they're sharply reduced for pretty obvious reasons. Increased federal unemployment led to increased private unemployment from companies that supported the federal government. Decline in leasing space, more vacancies, creating more difficulties in the office market for the people who have buildings to rent and now don't have tenants in those spaces. An uncertain economy. I mean, the mess he's made out of oil prices and things has a real impact on people, and all those things have shifted what people project would be our revenue increase. We still were projected to have revenue increase, but the revenue increase was substantially lower than the revenue increases that we've been having and the revenue increases that we actually anticipated. I'd say one of the worst impacts is on healthcare and the uncertainty of investment in the private sector in our healthcare companies, because Robert F. Kennedy's got whole lines of research that he doesn't think people should be doing. Those lines of research have a lot of money in them. And if those people believe they're not going to be able to get approval through the FDA because, for example, he doesn't want to do any mRNA vaccines, then it makes their investments a dead end if they're not going to be able to get approvals through the FDA. So he's introduced levels of uncertainty that no president has ever done. And that's a challenge we have. The state, as we all know, has been hit hard, and they've both reduced some of what they do, and they've shifted some costs to the county. Between this year and last year, $30 million has been added to our pension payment that comes out of our budget. That's about a penny and a quarter on the tax rate. Those were things we weren't paying for 2 years ago, but we're paying for now. It's unrealistic not to expect that it has a budget impact, and I don't think it's smart to simply shrug it off and ignore it. We expect more homelessness, more hunger, more uninsured residents, less support for education and economic development. And these are issues that actually have to be dealt with. We all know the president wants to see us walk away from these programs. His whole philosophy is the government program should foster, that he believes the government programs foster dependency. And if he would just stop housing people, feeding people, or providing the medical care, they would just go out and get jobs and find housing and everything would be fine. He's obviously never met any of these people and has no idea of what kind of struggles these folks deal with, particularly those who are experiencing homelessness. And I think the truth is he doesn't care what happens, but I do. This week, I asked our OMB team to provide 4 different resident scenarios to demonstrate the effect of the federal taxing cuts, including our proposed tax increase. So you can see in this chart that if you're a typical renter and you had a gross income of $100,000, which is high for a typical renter, your county income tax would go up about $33. Your property tax, the property tax on the property you're in would probably go up some, but rental property is not valued at the same rate that that normal residential property is valued at. They pay on their taxes are based on how much money they make. The rest of us are taxed on what our buildings are actually worth, our houses are actually worth. So for that renter, their total county tax change is going to be about $33. The federal tax cut for somebody making about $100,000 is worth between $430 and $994. If you're a working family and you've got a gross income of $225,000, which is far above the median income in Montgomery County, so just so you have an idea that this is still at the high end of working families, their income tax would go up $75 under our bill. The property tax would go up $403 for a total upward movement of $478. But the federal tax cuts can be worth between $1,600 and $3,000. If you're 2 working professionals and you have a $500,000 income, your county tax goes up $167. Your property tax on a house valued at $1.25 million, which is more than the average house in the county, so this is the higher end, would go up $788. So you'd totally pay another $954 to the county. Your tax cut is worth between $9,600 and $10,000 at the federal level. So again, it's a net positive for you. And if you're a retiree and you've got a $100,000 income and a home value of $800,000, you're looking at $33 on income, $504 on the county property tax, and you're looking at $537 total. And your reduction in taxes is going to be between $720 and about $1,300. So the total cost of everything that Trump has done and the things that we're picking up that we have to pick up is still going to be net positive for residents. They're going to be wind up paying less taxes than they would have paid before, even with the increases in county taxes. And I hope people think about, what it is that we're trying to do here. It is challenging when the county depends on both the state and the federal government for education funding, healthcare services for older adults, and housing, especially for those who are unhoused. When those sources begin to dry up, the county's faced with, I think, some pretty unpleasant choices. I'm committed to maintaining these services because the demands are only going to increase. We're already seeing it. I hope the council can support this approach because there aren't any magic solutions here. If they don't make the needed revenue changes this year, our financial stability is actually going to be worse next year. The state is already talking about an even larger deficit, likely more cuts. And unless they're willing to look at revenues, I think it's important that we figure out how we're going to avoid a downward spiral. I hate to think of the results of turning away people from healthcare, not feeding people who need to be fed, not housing the homeless. That will go over really well. There are a lot of problems that we just are inheriting and we have to deal with. And my budget is about as realistic as you can be in terms of dealing with things that the county needs to do. I want to turn now to a different topic and a really unfortunate topic. The elementary school incident in Bethesda at Bradley Hills Elementary last weekend, along with last week's fire on the school grounds. Both incidents are deeply concerning. We want families, staff, and neighbors of Bethesda to know we take these incidents seriously and are acting swiftly. MCPD, MCFRS, DHHS, and MCPS are working closely together to respond. The investigation in the fire is handled by MCFRS. The graffiti is handled by our police department. We've had an increase in police and security present at the school and the surrounding community over the last few days to ensure students and staff feel safe. And our folks are aggressively investigating this. We're asking the community to share any credible tips about these incidents with authorities. MCPD's non-emergency line is 301-279-8000. Direct reporting helps law enforcement respond quickly and appropriately. Please avoid sharing names, photos, or unverified information online. Do not contribute to the online madness that's out there in general by putting any rumor or any random thought you might have or suspicion that's unsubstantiated back out into the internet, because that causes more harm than it helps, and it can harm innocent people, which is not what we want to do, and it can delay the investigation. We're investigating this with all seriousness that this warrants, and it is deeply unsettling. We've seen too many school shootings to take this anything but seriously. We will hold those responsible accountable, continue working with our schools and public safety partners to protect our students and staff. And as we get more information, we will share it with you as soon as we have it. Last week, I attended the DHHS National Public Health Week Symposium, and I want to acknowledge last week was National Public Health Week. I took part in the symposium that brought together Montgomery County's public health professionals. This is the second year we've held the event to bring everyone together to recognize the hard work and dedication of our public health services staff. Their work revolves around preventing disease and promoting health. One of the best ways to do that is to eliminate health disparities. We do that because it works to save lives. Most people don't see the work public health professionals do behind the scenes. They don't see the inspections or the disease tracking, but we do get to see the results. Montgomery County continues to rank as one of the healthiest in the nation, much of that thanks to the work that they do. So I want to thank Dr. James Bridgers, Dr. Keisha Davis, Dr. Nina Ashford, Sean O'Donnell, and the many people who make up our Department of Health and Human Services, from the people who sit in administration to the folks who are out there in the front lines and working with people in the community. This doesn't work without you, and you do a pretty remarkable job in Montgomery County. So I'm going to start my updates this week with our health professionals.
Thank you, Mr. County Executive. And continuing with that National Public Health Week theme, thank you for all the support that you provide to this agency and its leaders. We do a lot of good in the community. And speaking of good, on this Friday, it's Earth, Tobacco, Litter, and Trash Cleanup Day in Wheaton. So we need your help. We need the community's help from 11 to 1 p.m. All volunteers of all ages are encouraged to support. There's on-site registration. I will provide the address in the chat box, but the location is Veers Mill Local Park. That's located at 4525 Garrett Park Road in Wheaton, Glenmont area. But it doesn't have to just stop at the Tobacco, Litter, and Trash Cleanup Day at the Veers Mill Local Park. Anytime you see any tobacco, any trash, it helps the environment. It keeps a environmentally friendly atmosphere in the community, and it's our responsibilities as stewards to keep our communities clean. Now, on a different note, I've been reminding our viewers every week about our mobile crisis outreach team. And I just want to say, one, to give them a thank for the work that they do. They often aren't aware of the situation that they respond to in a timely manner. But we've had some communication sent to us about the teams being culturally appropriate. We make every effort to make our diverse teams response as culturally appropriate as possible. Now, if you or our viewers are experiencing some concerns about that, the cultural appropriateness continues as part of that follow-up and case management and referral response to make sure that those individuals who are experiencing a behavioral health or a mental health crisis receive the type of support through the agency or its community partners that's much needed. And I wanted to share that with our viewers this morning because that's appropriate. And it's specific to some of the concerns that we've had. So we try to make every outreach as culturally humble and appropriate as possible. And when those instances don't care, there don't follow up. We have the case management and referral process. So I'll stop there and I'll turn it over to Dr. Ashford for her updates.
Nothing much more to add. Just want to echo thanks to the county executive for participating in National Public Health Week. And even though the week is over, the theme was Ready, Set, Action. And we hope that you will continue to support the work of public health in your communities every day, even beyond National Public Health. Thank you.
Dr. Stoddard, do you have any
No,
comments?
no additional comments.
Yeah. Okay. Well, members of the media, any additional questions for the county executive? I see Brad Bell, ABC7. Good morning, Brad. Go ahead.
Hey, Brad.
Good morning. Hello, Mr. County Executive. Hey, you talked about Bradley Elementary School. If as is often the case, this ends up being a kid, a juvenile, what should happen? What do you want to have happen? What's the message to out there?
I mean, you've got to find a way to show kids that this is serious, that this is not a joke. This is not, it is not good to terrify people. And they need to understand that that's a real problem. And the parents need to understand that's a real problem. If the parents aren't aware of this, or if the parents are aware of it, everybody's got to take responsibility. These are kids. They're raised by us adults. And what they do is on them, but it's also on, the community that we're in. And if they're being egged on or encouraged by people to do things like this, that's not a good thing. So hopefully we find out who did this. We find out whether it's a child or whether it's adult. We don't know who it is right now. But that we take it very seriously, and we impress on whoever did this that we're going to take it seriously, and don't think we're just going to say, oh, it's no harm, no foul. You were just kidding. There is no just kidding when you do stuff like this.
Thank you, sir.
Thank you so much. I see Jenny has her hand up.
Hi, so I wanted to ask, of course, about the data center. Has the county been briefed on the end user being Amazon, or what are your thoughts on that? Yeah, that's
So I can't talk about who end users are until somebody makes an official announcement about end users. So I'm not going to say anything about that. But it's a big data center company, and we are the council is working on legislation, and we're trying to convey to the current owner, what kind of legislation, what kind of restrictions they're going to be looking at, so that the end user is aware and that we can, hopefully work together on how we manage this.
With the state, sorry, I just want to follow up real quick. With this, what the state has passed regarding like all the new rules for data centers, will that apply? I know that won't take effect till later, but will that apply to this project? How, and I guess, is that something that you're going to echo in the zoning text amendments for this? Are this similar?
I haven't seen the final thing on this because they were talking about this up to the last day. So I'm going to get a briefing on what's new and exciting in the state regulation. But this data center, they haven't even gone into permitting yet. They haven't finished with parking planning. They haven't gone into permitting. To get to permitting, they're going to have detailed drawings of everything they're going to do over there. So they're a ways down the road, I think, from getting an approval, at least ways in terms of like probably a few months before they're, deep enough into this to be thinking about an approval. And that should be enough time for the county council to take action. If they can't take action before somebody files for an approval, then I've got the ability to put a pause on any approvals until the legislation's passed. And I'll certainly make sure that if I will not let an approval get ahead of the legislation that the council's trying to do. So if it looks like there's a push for an approval before legislation at the county level is done, I will put an appropriate pause on that until the county legislation is done. And I think, frankly, that any owner is going to want to wait for the legislation to be done anything, because the last thing you want is to do all your drawings based on, what you think is the reality today, and then discover that the reality shifts 3 months from now, and you have to go back and change everything. As somebody who's watched people do this, it is not cheap to do this level of design and work to get an approval. So I think they all understand that it would be unwise to do too much work before knowing what the rules are going to be on what you can do. Is that helpful?
Almost. It's help. It is. It's helpful. It's helpful.
Okay.
Definitely interesting to understand. I'm curious about the timeline for all of it. That would be my
Yeah.
next thought. Like how long would be for when you, I think I remember Natalie Fan Gonzalez saying that she was expecting the summer to be when it would be done. We're getting close to that, so I wasn't sure
Right.
exactly.
And we're tracking where the project is in terms of its approvals. It's going through park and planning right now on the zoning, and then everything else will follow.
Okay. Thank you, Jenny. I see Tosin has her hand up. Do you have follow-up questions or?
Yes, I do. Thank you.
Go ahead.
County Executive, I have a few questions. The first, I just wanted you to elaborate a little more on this impact of the federal tax cut, and how that links to your suggestion for the budget. If you could elaborate more, maybe throw a few more
Yep.
numbers out. And
So I
then,
guess, okay, let me start with that. Then I'll do the next one, okay?
okay, so
So just to be clear, we're looking at a number of things that are a result of what the president's done that are impacting the county budget. They're real. And the impact on the state, when the state shifted more of the pension to us, which they started last year. So this year it's, $30 million that we weren't paying before. Those are all things that were unanticipated, not part of the normal budget process. And so we have to deal with that. The president, as I said before, is very clear about shifting responsibilities to state and local government. He was always careful about saying, I'm going to shift the responsibilities. He didn't say I was also going to shift the cost, but of course we always knew that he was going to shift the cost. It wasn't like he was going to write us the same check and say, you guys go ahead and do it. Instead, we're seeing real reductions. We've seen real attacks on funding for homelessness. We've seen real attacks on the FDA and what kind of drugs they're going to approve. That makes a difference to the drug industry in Montgomery County. There are companies here that have made major investments, for example, in mRNAs and looking for, vaccines or, cures that they can do with mRNAs. If Robert Kennedy, who's utterly unqualified to make anything resembling a health decision, gets his way and you can't do mRNAs, then there's a whole bunch of research that gets paused until sanity returns to the FDA. It's hard to pause research. And these things are all impacting on the budget. The loss of federal jobs leading to the loss of private sector jobs, like everybody who supported USAID out in the private sector. There are whole companies that went belly up. Those are people who aren't working anymore. That drives up our unemployment. So we've been hit in a number of different ways, and we have these things shifting to us. So our point is that the federal government, in order to take all this stuff away from us, is enacting major tax cuts. And most of the money, it goes to the very wealthy. But what we were able to find out is that at these different levels, more akin to what people make in Montgomery County, the net benefit of the tax cuts is greater than the increases that we're putting into this, that we're proposing this year to fund basically programs that are meant to address the problems that we're facing going forward. We're covering, the $30 million in pension funds. If I don't put money in to cover that, then I'm looking at $30 million in cuts in programs. If you think about the county budget, when you subtract everything out of the budget, the largest departments we have are police and fire with almost $900 million. Health and Human Services is half of that, about $480 million. Those cuts there are all, you make a cut over there, you make a cut in service delivery, either reducing the funding we give clinics in the county reducing the amount of money that goes to homelessness in the county. All those things have repercussions. None of them can be done on less money than we did them last year. And with the demand being greater, I just got a request today from one of the healthcare providers who talked about how many more people they have served so far this year, and that they have to cut off now the waiting list. They can no longer take anybody for service for the rest of the year. These could be really serious cases, but they have spent what they were allocated to spend based on an assumption about the number of people who are going to be reaching out for help. And that number has already been exceeded and expected to go up and expected to get even higher in the coming year. So I guess my point I'm trying to make to people is that the effects of what's been done to the county has had an impact on the county revenues. And the impact on county revenues means that we don't have what we anticipated. We've had excesses, we've surpluses in our reserves. We're projected still to have an increase in our taxes, but our increase in taxes is less than was projected a year ago before Trump came into office. And that has left us, I can't budget with money I don't have. I wish I could just say I want to use the projections that we had last year. I can't do that. So we're using the projections that have been revised by the state. And that puts us in a situation where we either face serious cuts to programs, or we decide we're going to pay a little bit more. And I know people are sensitive about paying a little bit more, and we're trying to put it in the context of some of what precipitated all this. You're actually getting money in your tax return to offset the costs. So for most people, pretty much for everybody, it's net positive in terms of taxes, but it's a little less positive than it would have been if the county weren't in a situation to do what it's doing now. The other thing I'll say is, and I've been pushing this for a long time, and I have not had any luck at the council level, but I'll say it again. Montgomery County's residential property taxes are the lowest in the area, except for Washington, D.C. If Frederick County's at $1.11, Howard County's at $1.34, Montgomery County's at $1.03, we'd be at about $1.08 or $1.09 at that point. Fairfax County's over $1.15. The only place lower than us is the District of Columbia. They're at 85 cents. So any angry resident can say, why come DC's at 85 cents and you're at $1.03 or $1.08? I'll tell you why. Washington, D.C., commercial property is taxed at $1.89 if it's worth $10 million or more. That's pretty much anything that's standing in D.C. If it's worth $5 to $10 million, you're taxed at $1.77, and if it's $2 to $5 million, you're taxed at $1.66. If you're in Northern Virginia, in your commercial property, you're paying $1.15 plus 12.5 cents on every square inch of commercial property in Fairfax County. And then if you're in a special taxing district like Tyson's Corner or Reston, your taxes go up to about $1.50. So other jurisdictions have much more flexibility and raise far more revenue on commercial property taxes than Montgomery County. Myself and even MACA, with Republicans on board, pushed the state to allow counties to have the same differential tax authority that Virginia counties have and that DC has. Maryland municipalities, oddly enough, have the ability to tax commercial property at a different rate than residential property, but counties don't have that authority. So we asked for the authority. We had a bill through legislature last year and another bill and a bill back again this year. We could not get that bill passed. And when I asked people why not, it's because the county council, Montgomery County, doesn't support it. You guys are divided. And so, we're not going to support the bill. The county councils had the ability to give us the authority to create differential taxes like the other people we compete with, which would have taken some of this load off residential taxes. They chose not to do that. I'm going to continue it's too late for this year, but I'm going to continue to push that the county adopt a tax system that's more like DC and Virginia's, because and I will say in Virginia especially, because they're the poster child for this. It was actually the business community in 2012 and 13 that asked the Virginia Assembly to give the Northern Virginia counties the ability to tax commercial property at a higher rate than residential property. That didn't come out of the council there. it came out of the development community wanting to see progress on economic development projects, particularly transportation. So there are ways to avoid this. There are ways to reduce this in the future. But if we're just going to say we're not going to change anything in our tax structure and we're going to keep focusing the way we do right now on primarily residential taxes, we're going to struggle.
Thank you, Mr. County Executive.
And the other part of her question.
Well, I was going to ask, you answered it all. I was going to ask about your message to people about the tax increases and then the federal tax cut reducing the burden on people, kind of balancing things off. But you answered all of it in one take. So thank you.
Thank you.
Excellent. Any additional questions, members of the media, for the county executive and other county officials? No more questions? Well, thank you everyone for joining us this morning. Have a great rest of your day, and we'll see you next time. Bye-bye.
Thank you all. Take care.